Welcome, everyone. This is Dr. Mercola, and today I'm here with Dr. Hunting Hockey, who has been was an expert in vitamin C. He's a physician, has personally supervised over 60,000 intravenous vitamin C administrations, and really, we were fortunate to find him because he just came back from a conference that he sponsored in Japan on vitamin C. So he's really, truly is an international expert in this area, and I'm just delighted that he's able to spend some time with us today and really enlighten us about really an important modality that really, with the advent of many of these newer antioxidants and such, I think is somewhat taking a back seat. But certainly vitamin C is the grandfather of the traditional antioxidants that we know of. So welcome to our call today.
Thank you, Joe.
Can you give us a bit of a background of your professional history, how you got interested in vitamin C, and how your journey in that process has occurred and what you're doing with it now?
Well, I'm a family physician, and I've always been interested in health and wellness. And about 22 years ago, joined Dr. Hugh Reardon, who, after Linus Pauling and Ewan Cameron did the initial research on IV vitamin C for cancer patients, the Mayo Clinic reportedly replicated their study. Of course, they did not give it intravenously. They just gave oral vitamin C, and they were not able to get the outstanding results that Pauling and Cameron got in their study on cancer patients. And so there was a long controversy, and then Pauling died. And so Dr. Reardon pretty much took up the flag and carried on a 15-year research project called RECNAC, which is cancer spelled backwards. And he was able to do some of the initial groundbreaking research in cell culture showing that vitamin C was selectively cytotoxic against cancer cells. And so we then embarked upon a whole series of patients who had either stage 3 or stage 4 cancer, and IV vitamin C was found to be very beneficial. Now, it's not considered a standalone therapy for cancer, but it's a perfect adjunct to any kind of therapy that the cancer patient is receiving at this time, and it will reduce side effects and improve quality of life. And there's actually been 2 major studies now showing how it improves quality of life.
Interesting. I hadn't realized that you really have taken up the banner that Dr. Pauling had started, who's well recognized as really the leader and the innovator and founder of the interest in vitamin C, ascorbic acid, and that you really followed in his footsteps. So now, with Dr. Pauling's work, he's really known for the two points, which is really the treatment of cancer, but also the treatment of infectious diseases, specifically viral upper respiratory infections. So, do you in your work, are you primarily focusing on the use for a cancer adjuvant, or do you also use it for infections?
We use it for just about everything. Certainly, anyone that's got a cold or a flu or chronic fatigue or any chronic viral infection, we do use that. We had our first Reardon IVC in Cancer symposium last year, and Dr. Tom Levy was our keynote speaker. And of course, Dr. Levy wrote Curing the Incurable, which is a fantastic book about vitamin C, infectious disease, and toxin control. And so certainly IV vitamin C works very well for infectious diseases as well as cancer.
Yeah, we just recently posted an article in our newsletter something that received quite a bit of notoriety last year with the swine flu epidemic of an individual, I believe in Australia or New Zealand, who came down with terminal swine flu, was diagnosed and really given a few days or weeks to live, and I think actually contacted Dr. Levy and was given the administration IV of vitamin C and actually recovered from it quite nicely.
Yeah.
So
yeah, definitely. It's definitely a very underutilized modality in infectious disease. It's really a premier treatment for any chronic infection, but again, it's not typically recognized by conventional medicine.
Now, the vast majority of the people watching this or listening to this are not physicians. And there's really two primary ways you can administer vitamin C. One is orally, and the other is intravenously. So, obviously uses a lot of intravenous. And if you're going to use the intravenous approach, you really have to be a healthcare clinician and licensed in some way to be trained and then certified to be able to do that. So maybe you can expand on those just different approaches for us.
Yeah, I mean, for the average patient, I'm certainly going to encourage them to continue taking at least the Linus Pauling dose, which is a 1 gram twice a day of vitamin C. Certainly, you can do more than that, and if you're suffering from chronic infections or chronic fatigue, you can go ahead and gradually increase your dose up to what's called the bowel tolerance dose, and it's very safe. The whole idea that vitamin C causes kidney stones, we have completely disproven that. I've often told patients if that were true, we would be the kidney stone capital of the world here in Wichita, Kansas, for as many IVCs as we give and as much vitamin C as we recommend. But there's been several studies by urologists that have shown that that is just simply not an issue with high-dose vitamin C. So for the typical patient, oral is fine, but if you really have a serious illness, you should think in terms of doing intravenous vitamin C from a practitioner, because it can greatly amplify and change the benefits of IV vitamin C.
Interesting. And what are the typical doses you find in intravenous vitamin C that are administered?
Well, we have, my talk over in Japan last week was the Reardon IVC Protocol, and in that protocol we recommend a patient who's never had vitamin C intravenously. First of all, we recommend that people get a G6PD level. And the reason for this is that's an enzyme that the red blood cells need to maintain the integrity of their membranes. And what people don't understand is that high-dose intravenous vitamin C is a strong pro-oxidant. And a pro-oxidant in a G6PD deficient patient can cause hemolysis of their red blood cells. And so using IV vitamin C is not for just the novice. I think you should be going to an experienced practitioner who is using at least the Reardon protocol or some kind of protocol that's going to make sure that they use the vitamin C intravenously in a safe manner.
But this G6PD deficiency is relatively uncommon.
It's relatively uncommon, and quite
it's
frankly,
not something like every other person has, right?
No, you're talking more about Mediterranean descent, African descent patients, and even then it's pretty rare. I would say we did a series of over 800 G6PDs, and we only saw 4 deficiencies. Okay. And of those 4, we were able to give 15-gram IV vitamin C. However, I do have knowledge that there have been practitioners who've given a 15-gram IV vitamin C, and the patient did experience hemolysis. And so from a medical legal perspective, it's best to do a G6PD before embarking upon
probably less
vitamin C.
In your experience, less than 1 person in 200, which is, so the odds are you're not going to have it, but right. to be comprehensive, you really need to do that.
Yeah.
Now, the doses that you're using is about 15 grams. You ever go higher, 25, 100?
Yeah, what the Reardon research found was that a blood level of around 300, 350 was necessary to have this selective cytotoxicity. Now, since then, we've probably geared that down a little bit, maybe even as much as 250 milligrams per deciliter is going to be sufficient to have an anti-cancer effect. Now, just to put that into perspective for the average person, if we were to measure someone off the street, their blood level would be about 1 milligram per deciliter if they're eating a fairly decent diet. If they're less than 0.6 milligrams per deciliter, they're into a scurvy type range of vitamin C. But what we're talking about for a post-IVC saturation level, giving, let's say, 25 to 50 grams of vitamin C IV over about a 90-minute period, is something in the 200 to 300 milligram per deciliter range. So we're talking about 200 to 300 times the normal amount of vitamin C that your blood normally experiences just eating a balanced diet.
And these extraordinarily high types of levels are really mostly indicated for the treatment of cancers and infectious disease. Is that correct?
That's right, because when you get into these, as you say, extraordinarily high blood levels, what happens is vitamin C, which will always be an antioxidant, nevertheless starts to have a pro-oxidant effect. And this has been documented at NIH in 2 studies. Matter of fact, at our second annual Reardon IVC and Cancer Conference, we had Dr. K. Chen, who was the author, along with Mark Levine, on high-dose vitamin C as a source for creating hydrogen peroxide in the extracellular space surrounding tumor cells. And it's thought that it's this hydrogen peroxide or pro-oxidant effect of vitamin C that's actually having the anti-tumor property, as well as it's that same pro-oxidant effect that's helping the body get rid of infectious disease.
So in your experience in using it for these conditions, what are some of the more dramatic examples that you've seen over the last 20 years? I mean, you've as you mentioned earlier, you've given over 60,000 doses of IV vitamin C. So I'm sure in over 20 years you've seen, quite a few dramatic recoveries, because if there's no way you would still be doing this over 2 decades if it wasn't effective.
Yeah, Dr. Reardon's very first case was a stage 4 renal cell cancer that had metastasized to the lungs. And basically the oncologist had said, there's nothing else we could do. Go ahead and get your things in order. And that's when the patient had read about Linus Pauling's research. And so he came to Dr. Reardon, and Dr. Reardon went ahead and started giving him, started out with the 15 grams, but he moved him up to 30 grams twice a week. And after 2 years, actually it was after 1 year, the metastases were completely gone. The oncologist called him up and asked him what had he done, because he had never seen a stage 4 cancer go into remission. And we've actually had very good success with renal cell, bladder cancers, and lymphomas. Those types have been very effectively treated with IV vitamin C.
Okay, now I just want to go back to a basic supposition and really address many of the skeptics who will be viewing this and say, I don't believe you. Well, Dr. Linus Pauling actually won 2 Nobel Prizes. One was in science and one was for peace, but he really should have won 3, because he really almost won the Nobel Prize for discovering the DNA, so he should have had 3.
That's right.
I mean, he really was a brilliant man. And he wrote the book about vitamin C, and he was just castigated in the public. And there are many people, scientists, who kind of used a variety of ammunition to discount what he said, even though he was clearly a genius. So I'm wondering, and then if you could comment on why this approach hasn't been adopted. I mean, you've been getting tremendous success. Why hasn't conventional medicine caught on to this? Why aren't they using it more? I mean, what is the limitation, the confounding variables that's preventing people or physicians and clinicians and researchers from adopting